Have you heard? What you need to know about raw food diets. Many pet owners are saying no thanks to commercial pet foods and opting for raw food diets for their pets. A recent review of research data on feeding raw food diets looked at why this is occurring and what concerns veterinary professionals should have for their patients and clients when a meat-based raw food diet is being considered. So why are clients turning to raw food diets? The answer is multifaceted and includes social and cultural draws, as well as the desire to gain some control over a pet's health and well-being. Adding to this, incidents of contaminated pet food ingredients have fueled many concerns over the safety of feeding traditional commercial pet foods. The evidence available assessing the benefit or risk of feeding raw food is limited. However, there have been case reports of hypervitaminosis A and pancreatitis in cats, and nutritional osteodystrophy and nutritional secondary hyperparathyroidism in litters of puppies fed raw food diets. Analysis of several raw food diets, some commercially produced and some homemade, showed low amounts of calcium and phosphorus in several, and the commercial diets were high in vitamin D. Furthermore, some were low in potassium, magnesium, and zinc. In support of feeding raw food diets, it has been suggested that cooking diminishes the nutritional quality of food by reducing digestive enzymes, which interact synergistically with enzymes in the digestive tract. However, the current research on this in human medicine concludes that there is no evidence to support that cooking food leads to any disease process, nor is the significance of enzyme synergy known. Where the raw food diet data is richest is in the area of infectious disease. Several studies document the presence of infectious agents such as Salmonella, Escherichia coli, and others in raw meats. The potential for shedding these agents in the pet's environment is great. Other studies have had similar results, whether looking at frozen commercial raw diets, at raw diets fed to healthy therapy dogs or racing sled dogs, or at greyhound facilities. Animals fed these raw food diets with signs of gastroenteritis, diarrhea, or even normal fecal samples showed increased shedding of either Salmonella or E. coli. Perhaps more alarming is the documented risk of antimicrobial resistance in many of the isolates. Analysis of commercially available raw food diets identified 18 Salmonella serovars resistant to 12 of 16 antibiotics tested. Why is this so concerning? Multi-drug resistant Salmonella species outbreaks have occurred in several animal facilities. Disturbingly, some of the animals in the facilities and at clients' homes were asymptomatic, but still had positive culture results. In addition to animals at these facilities, veterinary staff, pet owners, children, and other pets became ill during these outbreaks. Salmonella species in pet food can affect people, especially young children in the household. As this review article stresses, if choosing to feed raw meats, hygiene of the preparation area and feeding bowls must be strictly maintained. This can prove problematic since standard methods of disinfecting, such as using a dishwasher and soaking dishes in bleach, have been shown to be ineffective in removing Salmonella species. While there is a need for further risk and benefit data on feeding raw meat diets in pets, clearly there is reason for concern, and veterinarians should discuss the human health implications when consulted on this choice. For more detailed research results and analysis, you can find the review and a list of study references in the January issue of the Canadian Veterinary Journal.